Okay, so this is Dr. P talking about CGM, which is continuous glucose monitor. So what is the difference between CGM and blood sugar monitoring? Blood sugar monitoring, you get one data point for every prick you do. So in a day, you can do 4 to 10 checks, whereas CGM gives you multiple data points drawn from your interstitial fluid, not from plasma glucose, and this will give you more than 200 readings in a day. So the advantage is you can see a pattern with CGM, whereas with blood sugar monitoring you see data points. So when you try to analyze, you need to remember there will be difference between the blood sugars and the interstitial fluid CGM. So it cannot be orange to orange, but more about data interpretation with the graphs which are created. There are several brands of CGMs which are available in the market. So your provider will let you know which one to go with and the reasons. Sometimes it might be the insurance company. There are also implantable version of CGMs which are available for adults and not available for pediatrics at this point of time. And the number of days you have the subcutaneous monitor helps you not to prick the fingers multiple times. So it can be 10 to 14 days. So once you put it on, it continues to give you data on a continuous basis for more than 2 weeks. It can also be integrated with the insulin pump. So the data from CGM can go into the pump to help you analyze how much of insulin to be given. But the most important thing of CGM is to give you the ability to follow the patient you are following, either be your child or an important family member, or it could be your patient from a remote location. So you can have the data seen on a consistent basis. But more important thing for a physician or a caregiver or anybody who is wanting to make changes in the treatment is actually the interpretation of data. So if you are having a CGM, the key thing to learn is not just to follow the data, but how to interpret the data and how to modify your lifestyle or your medication. Thank you.